listening. Okay, and Nancy, I'm going to turn it over to you. And Nancy, I can't hear you yet. Uh-oh. Did I lose Nancy? Oh, there she is.
There you go, the slow mute function there. Sorry about that. Okay, so welcome everybody, and thank you so much for taking time out of your very busy schedules to join us today for our webinar regarding our new New Jersey EDDI Audiology Facility Report. My name is Nancy Schneider. I'm the audiologist with the New Jersey Early Hearing Detection and Intervention Program, better known as the New Jersey EDDI Program. And as you've already met, I'm joined today by Kathy Avini, who is our New Jersey EDDI Coordinator and Research Scientist for our program. And if I could have you advance that, because I'm not able to do that for some reason. There we go. I have so many different audiologists on the line, all from different clinical venues, and some of you are very, very familiar with the EDDI program. Some are new to it. Just as a general overview, EDDI is a national public health initiative that supports the early identification of hearing loss in infants and toddlers through the use of universal newborn hearing screening, timely audiologic and medical evaluations, connection to family support services, and enrollment in appropriate family-centered, culturally competent early intervention. Most folks are very familiar with the big national EDDI goals, which are universal throughout our country and also our territories. The 136 rule is the rule that says that we want to make sure that all infants are screened for hearing loss by 1 month of age, that those who don't pass for 1 or both years undergo diagnostic audiologic evaluation by 3 months of age, that children are enrolled in appropriate family-centered, culturally competent early intervention by 6 months of age, and there's also another rule that everybody knows about that doesn't quite fit so neatly into that 136 category, that we want to make sure that children who have risk indicators for late onset hearing loss are receiving periodic audiologic evaluation. But what most people don't realize is that included in those national EDDI goals is that all the EDDI programs throughout the country need to have some type of tracking and surveillance system in place that basically drives all the follow-up efforts in our program to make sure that we are indeed meeting those 136 goals. And in order to meet them in a timely and efficient manner, we need to have a collaborative effort from everyone from the hospitals to audiologists to physicians to anybody else involved in doing screening or testing of infants and toddlers to make sure that they're reporting the results of their inpatient and outpatient data. And in New Jersey, our whole process is led by our program here at the New Jersey Department of Health at the EDDI program, where we have a secure and comprehensive centralized database. Thanks, Kathy. The primary purpose of tracking and reporting and follow-up, it's not just to take lots of time out of your crazy busy clinical schedules to have to do paperwork, but it's really the only way that EDDI programs can ensure that all the babies throughout our state are being screened, and that those that do need follow-up, whether it's rescreening, diagnostic testing, audiologic monitoring, are getting those services in a timely manner. Also, for our program, it's also very important that the data that's generated through this whole tracking system that we have and the reporting and the follow-up provides the basis for measuring our state programs' EDDI goals and how effective each component of the EDDI process is. Are the hospitals making sure that they're getting the kid to refer on for rescreening and diagnostic testing? Are they getting comprehensive testing? Are they getting both ears tested? And are they doing so in a manner that meets the 136 goals? It also points out to us program strengths and weaknesses so that we know what we need to be working on from our end at the Department of Health. There are 2 sets of regulatory requirements that mandate that audiologists report the results and recommendations of outpatient audiologic screening and testing. One falls under our New Jersey EDDI regulations, and the other is included in our licensing board regulations for audiologists here in the state of New Jersey. So you are definitely regulatorily required to do reporting, and to do so when you see a child that you report to us within 10 business days of when that event occurs. I just wanted to show you also quickly before I turn things back over to Kathy about to talk specifically about the Audiology Facility Report is to sort of show you an example of what we see on our end. I mean, you're filling out form after form after form on all the kids that you see, but just to kind of give you an idea what sort of prompted this whole Audiology Facility Report in the first place as to, what happens with individual children throughout the state. So we've got Marcia, Jan, and Cindy, and each one of them had a very different newborn hearing screening and follow-up experience. Marcia, who had the best experience, had her initial hearing screening done very soon after birth. She was in the NICU, so it did take about a week and a half for her to be seen, and she referred on her automated ABR for both years. She had an outpatient rescreening within a month, which is what we were hoping for. Unfortunately, she referred again on that ABR and was referred for a diagnostic ABR. And our 136 goals, remember, tell us that we want to make sure that that happens prior to 3 months of age. In her case, it did. She was diagnosed with a profound sensory neural hearing loss and enrolled in early intervention a couple of months before the 6-month benchmark. So that's the sort of perfect scenario for a child who has been diagnosed with hearing loss for it to happen just all that quickly. So that's Marcia. Unfortunately, Jan did not do as well. Even though she was screened initially just a few days after birth, she referred on OAE screening for each year. She was rescreened again. If you're going to be doing a rescreening, we want that to happen within a month of life because we're trying to make sure that if diagnostic testing is needed, that it can be done without the use of sedation. Unfortunately, her outpatient rescreening didn't occur until she was 2 months old. She referred again, and then she kind of got lost in the sauce. I mean, she just was gone for almost 2 years, and when she came back, had yet another screening and referred again, and as you can see, she referred. She had a diagnostic ABR, and now she's getting quite old at this point. It was inconclusive, and another diagnostic ABR 4 months later, which identified an asymmetrical and significant sensory neural hearing loss. There's just so many sad things going on here because this child never could have even participated in early intervention given that her diagnosis occurred after the age of 4. And the thing is, it's sort of an example of why we really want you to kind of go forward with that diagnostic testing and not hold back because the child has middle ear infections, because they could have fluid for a really long time, and we really want to find out what's going on and if there's an underlying sensory neural component. There's no reason that this child's sensory neural hearing loss couldn't have been identified several years before, and so I just wanted to kind of give you an example of a bad situation. The last one is Cindy, the ugly situation, where she had very different screening results over the course of the first 2 months of her life. As you can see, the ears kind of switched on which passed and which referred. She didn't have a diagnostic ABR until several months after that last screening, but it was inconclusive with a recommendation to return in a month. She had 2 more ABRs. Again, inconclusive. I don't know what was inconclusive about it. We don't get that level of detail. But the strangeness of this is that the recommendation for this child was to return again in 3 months. So you can see that she's already going to be going way out into that late identification of hearing loss, and probably also will not have the opportunity to engage in early intervention. So those are just some examples of what we see, and that's why we thought it would be a good idea to speak with all the audiologists about audiology facility reports and trying to improve your facility's ability to get children in a timely manner. And for this next section, which all this data stuff is definitely not my area, so I'm going to turn things over to our data queen, Kathy Avini, to talk to you now.
One of the things that we do with the information that you send us is that annually the Centers for Disease Control and Prevention, the CDC, request data from us. They request data from us and all of the states and territories which they provide grant funding to. And they take that, and it's aggregate data, it's numbers, and they take that data that we make available to CDC and they post it on their internet site. And the URL is there if you want to go look and compare how New Jersey is doing to other states. And so this is the data that's currently on their website for babies that were born in 2011. And you can see I've highlighted the numbers and the data that we gave to CDC for New Jersey. And we talk about screening rates and babies that don't pass, and that information is coming from the hospital screening data. But it also includes numbers of babies that were diagnosed with hearing loss, numbers that had a diagnostic exam, whether that's a diagnosed hearing loss or normal hearing. And the final column there that I've highlighted indicates the percent of babies that were diagnosed before 3 months of age, diagnosed with hearing loss or diagnosed with normal hearing, so had a complete diagnostic testing done prior to 3 months of age. And I know it's a little small on the screen, but basically that number there for New Jersey for 2011 was 67.6, and you can see that the national average was 70.8. So we're doing a little bit worse than the rest of the country. And one of the audiologists who got our audiology facility report that we're going to be talking about in the mail actually had called Nancy with a question, and she described it as the report card. You know, this report card that you sent me. And so what I'm showing you here is really our New Jersey Eddie's report card. And so this is ours, and we'd like to do better, and we'd also like to share the love of, you know, having this report card with you, the audiologist in New Jersey, because what you're doing in your office is contributing to that number there that you see in front of you. And so we're wanting to help you see what you're doing, how timely your exams are, and how that contributes to the success, whether or the lack of success that New Jersey is having, and see how we can work together and strategize to improve that rate. And I also want to say, too, that like that idea of a report card, to me, this audiology facility report that we've created is more of an interim progress report. So, you know, if your kid has that, you know, grade that they come home with and it's the middle of the semester and, you know, maybe they're pulling a C, but you know that by the end of the marking period they may be able to bring it up to a B or an A. And the reason that they send those interim progress reports home, or we get them online now for our kids, is so we can look at improving your child's homework study habits or improving, you know, what they're doing and the quality of their work. And so that's what our goal is by sending out these facility reports. And it's not meant to be punitive. It's meant to be, you know, let's look at this together and let's look at how we're doing and let's look where we can identify opportunities for improvement. So a little bit that you need to know about our EDDI data system, just very basically, our inpatient screening results come to the EDDI program via the state's electronic birth certificate system. The outpatient data is coming through the outpatient follow-up exams that are entered on our outpatient follow-up report, and then that data is entered into a module that's built into our state's immunization registry. Data from those two data systems are made available to us at the EDDI program, and I merge that data together so I can track children from screening through to diagnosis and also through to early intervention. What you're seeing now on your screen is what the paper copy of that outpatient newborn hearing follow-up report looks like. If you are using the paper version of the form, I want to point out to you and remind you that you want to be sure you're using the most recent version of the form. We have made modifications to the form over time, some of that based on feedback from the audiology community to improve it and make it better for what you're reporting. And also sometimes the other changes. If you look at the ear-specific results section, we include now auditory neuropathy and dysynchrony, which didn't used to be on our form, and that was added because the CDC report that we submit has those categories now. So we're trying to collect the information from you that we need to then turn on to report as part of our national reporting. And so the date, if you're using the paper version of the form, is in the lower left-hand corner, and our current version was modified in July of 2012. So that's the date you should be seeing and looking for. If you're working with the paper version of the form and you've got an older copy of the form, please call us, email us, let us know, then we can send you some new ones, or you can also download the most recent copy of the form from our EDDI website. And this is just a screenshot for the EDDI module in the immunization registry. This is our test from our test database, so all of the names and identifying information you see there is all faked. And I do want to say, I'm glancing at the list of the people who are on today's webinar. I know that many of you are already using the system. If you are not using this electronic system to submit your results to us of outpatient testing, we would encourage you to do so. It's easier and it's quicker, and one of the other benefits, like you can see on the screen, is that you can actually see the inpatient screening results as well as any outpatient testing that was done maybe at facilities other than yours, and have a more comprehensive idea of what's going on with the baby and have access to that. And we're happy to set anybody up with access to that system and do the training. You just need to contact Nancy or I. So now I wanted to get into the meat of talking about those reports that were sent out. So hopefully, if you got one, you might even have it in front of you and sitting in front of you. And I just kind of took copies of the pages of the report, the sections of each of the pages of the report, and we're going to talk about each one, and we're going to work our way through it. Now I want to start by saying that some of you on today's call may not have received this facility report at all, because we ran it just meeting some certain criteria that we're going to go through. So it could be that the reason you didn't get one of these reports in the mail is that you really haven't seen any little newborns that failed their screening in the hospital, and haven't seen any children that met the criteria for inclusion in this report. And that's okay. And it's good that you're still on, because if you see one of those babies next week, the next time we run this report, you'll get one. The other thing that might be is maybe you did see some little newborn babies and you forgot that you were supposed to send that report to us, and so we don't have that information. So we didn't know that you saw that little 2-month-old back in January. So hopefully if you are seeing babies routinely in your facility, then you should have received one of these reports, and if you didn't, that's something to give us a call offline and talk about and see if we can fix that. So who we included, and your report will start with the name of your facility at the top, and there are some date ranges included on the printout of the form. So we picked a 1-year time frame based on a child's date of birth, again, because we usually report when we're reporting to CDC and so forth based on a year of birth time frame. The other thing to keep in mind is that this data is very fluid. We get new forms coming in every day, so if I were to run this report today, it would look different from what was sent out into the mail to you last month. And so the cutoff date is included on the report, so that gives you an idea. So if you saw a baby on November 5th, well then clearly we didn't have that form yet. It includes babies born only at New Jersey hospitals. And I'm going to get a little bit more into that as we talk a little bit more. But basically, the next thing that I'm going to say, and this is part of why we're only including New Jersey hospitals, is it includes only babies that referred on inpatient hearing screening. Now, many of you are seeing plenty of other babies. You're seeing babies for follow-up, for risk factor monitoring. You're seeing babies later on in life for concerns about hearing. And we decided for this first attempt at an audiology facility report to focus on those babies that really were the most concerned about with respect to our follow-up and tracking process, and those are the babies that referred on their inpatient screening and need additional outpatient testing. And so I only know if they referred on inpatient screening if they were born in a New Jersey hospital. If they were a New Jersey resident but they delivered out of state, I often don't have access to that information. The other thing that we're including is we're only including follow-up that happened for the purposes of this report. We're only including follow-up that happened at audiology facilities. In New Jersey, we do have some pediatricians that do testing in their offices. They have an OEE machine in their office, and they may do a rescreening on their babies in their office. We also have hospitals that will do rescreening by their nursery staff. Particularly hospitals that don't have an audiology department, the same staff that does the inpatient screening may do an outpatient rescreening just once or twice, usually just once, and then refer them on to an audiology facility if they don't pass that rescreening. And we realize that the criteria just for children getting to those places are very different for audiology facilities versus pediatrician offices and hospital rescreeners. And so to really compare apples to apples, we really wanted to focus on just the audiology facilities. And again, it also includes only New Jersey audiology facilities. And there was an exception that I'll talk about and I'll get to later, but basically this follow-up included, when we're looking at state totals and state averages, is a follow-up that occurred in New Jersey audiology facilities. So the first actual number or count that you see is a volume, a number. It's a count of children, not encounters. So if a baby came to your office 5 times, it counts as 1 baby, not as 5. And it counts, obviously, forms that were received by our program. Now, again, babies who were born in New Jersey and referred on their inpatient screening and have had outpatient rescreening or diagnostic testing at an audiology facility should always have had a form sent to us. But again, if a form wasn't submitted, I can't include that information in our reports. So one very just simple goal of this is for you to look and say, oh, and this is sample data, by the way. The state numbers should be the same in the report that you received in the mail. The Your Facility numbers are just some random samples I picked out. So for this sample facility, you know, they had 27. Well, does that make sense to you? If your report says 27 and you really know you saw 100 babies during that were born in the last year, then you're probably forgetting to submit some of your forms to us. On the other hand, if 27 sounds about right to you, then that's a really good thing. And we also thought it might be interesting for you to just see what percentage of the babies that needed follow-up after an inpatient refer come to your facility as opposed to other facilities throughout the state, and what kind of volume you have, and that might be useful for, you know, your administrators in your facility. See if maybe, you know, give you the ammunition you need to hire another audiologist on your staff because, oh, look, we see, you know, 10% of all the kids in the state. So we hope you find that information helpful. The next grouping of information is something that is really of more concern to us and is part of what I pointed out when I talked about the CDC data, and it's really talking about the timeliness of follow-up. So we gave you 2 statistics. One is the average number of days it takes from the child's date of birth until they have the first rescreening exam that they had in your facility. And the other is the average number of days from the date of birth until the first outpatient diagnostic exam. And as Nancy mentioned earlier, our goal is for babies to be rescreened, if they're just going to have rescreening done, by 30 days of age, and that for diagnostic testing to be complete by 90 days of age. And so you can see how we're doing statewide. Our time to a rescreening exam is a little higher than that goal that we would like to obtain of 30 days. So we'd like to continue to work on that. And for the first diagnostic exam, we're closer to our goal. We're only a little bit over it, and we're doing well. And again, you have on the reports that were sent out in the mail your facility numbers. And in this example, the facility numbers are, you know, substantially higher than the statewide average. So that's a case where a facility might want to look at what their practices are and what they're doing. And we realize that some of these factors are out of your control, like parents getting their insurance card or just getting around to calling your office and scheduling a visit. Others you may have limited control over, like how many appointment slots you have available to newborn babies. And I want to point out that we're certainly working with hospitals and pediatricians on these issues to make sure that they understand that they need to make the referrals, that the pediatricians need to make the referrals, that the hospitals need to remind the family that they're going to have to call their insurance company to get the baby added to their policy before they schedule audiology. So we're working with the other players in the EDI process as much as we can, but we also want to work with you. And I'm actually going to turn over to Nancy just for this next slide to talk about some of the things that we think audiology facilities may be able to do to improve timeliness.
Thanks, Kathy. Yeah, some of these things you may have already thought of and looked into, but, you know, just some considerations as we've spoken with audiologists throughout the state in different clinical venues, you know, to take a look at, you know, when is your next earliest available appointment for rescreening and for diagnostic audiologic evaluations? Is there anything that can be done in your schedule that can improve that timeline if there's something that can happen within your staff that you might have availability to see children more sooner? Are there appointment hours available on the evenings or the weekends that might be helpful for families to come in? What's the process that you have if a non-English speaking parent were to call your office or a deaf individual? Is that streamlined enough so that there's no issue with somebody calling? And, you know, we've had families tell us that they've called places where maybe they've been hung up on, you know, or that there's not anyone that they can speak with that is able to communicate efficiently with them. Do you require that the family has insurance information before an appointment can even be made? Some facilities do require that, but if it's possible for at least the appointment to be made and then the families can be working on that in the meantime, then at least they'd have the appointment in a timely manner. Are the folks who make the appointments for you, if not yourself, if your secretarial staff or if there's an automated system, I'm not sure, but whoever is making that appointment, are they familiar with what the person who is calling might be asking to have done? Do they understand the difference between a screening appointment and scheduling a diagnostic appointment so that you don't have someone showing up for what might be only a 15-minute or half an hour appointment when they really need an hour and a half for a diagnostic ABR? Likewise, if a family says that they just need a screening, do they know that, you know, they're going to need to have an ABR screening or an OAE screening depending on what they didn't pass in the first place? If you have a slot that is good for that amount of time, it might not matter, but still we want to make sure that if someone is calling, it's the type of screening that you can do at your facility, and if not, instead of having the family come on out for that, that they're directed to an alternate facility that you might know of in your area that can perform that test. And lastly, are the parents given good instructions, both verbally over the phone, and if you have something available in writing that can be sent to them in advance as to where the actual audiology office is at your facility, maybe some information about where to park or bus routes to you, emphasizing the importance of coming on time, which is always hard, but also arriving with the necessary paperwork you need to be able to see these kids. Do they have their prescription, a referral, whatever, insurance card? And lastly, are the families given information about how best to prepare their infant for a good screening or a good testing? If that can be available to families in writing as well, we have found with some facilities that's been very, very helpful. So we just wanted you to think about some of these things if it might help in improving the timeliness of getting in to your office for screening and testing. So I'll turn things back over to Kathy.
Okay, the next section is, instead of about the exams themselves, they're really trying to assess the reporting process. And so the first thing that we looked at is, are those follow-up reports getting submitted to us in a timely manner? And as Nancy mentioned earlier, it is in our regs and in the audiology licensing regs that anytime you do an exam on a baby that needed follow-up after referring on a newborn hearing screening, that newborn hearing follow-up report should be sent to us within 10 business days of the date that the exam was conducted. So we realized that there's some, mail weekend time in there as well, so we kind of set the goal as that we'd like this to be under 14 days so that you have your 10 days to actually send it, and it has a couple days to get here in case it's being mailed, and then 1 day for it to get data entered. And you can see statewide we're well within that. We're at 8 days. And what's really contributed to that, and some of you may see that your facility rate may actually be under 1. There are a few facilities where it's actually 0. And that is because if you're using the immunization registry interface to report your results, and you do the data entry the same day that the child has its visit, then the exam date minus the data entry day, it's the same day, so that calculates out to 0. So if you see a number near 0 or very close to 0, that shows me that you're using the immunization registry and you're getting it in right away, which I love because it means you're not forgetting and that kid's not slipping. But we know sometimes, they were seen at 5 o'clock and you have to get home and you're going to do it tomorrow. The other thing, if your number is particularly high, think about, have there been times where at the EDDI program we reached out to you and said, hey, we heard via a case manager doing outreach to the family or doing our outreach to a physician saying, gee, we have this child there's no follow-up reported, and they reply back to us, oh, well, baby was seen at ABC Audiology Facility, and then we reach out to you and you say, oops, we forgot to send that form in, and you send it to us. Well, unfortunately, sometimes that process for us to actually get in contact with a parent or a pediatrician and to hear that they went to you may not happen until a couple or several, sometimes months after the exam. And so then there's just one case where you forgot to send a form and we finally got it, but we got it 6 months after the exam took place, and that can really skew the number for your facility. So that's something to think about, and to think about ways that you can be timely with that. And I want to point out that one of the reasons that we're so concerned about and interested in the timeliness, I mean, great, the testing was done, maybe the baby passed, and you know the baby's fine, and the family knows the baby's fine, and hopefully the pediatrician got a report and knows the baby is fine. But we still have that baby in our data system as not having follow-up, and we do have a process where we have case managers that will do outreach to families. They'll call families, they'll call pediatrician offices to find out what happened. And here's my soapbox. I'll try and make this really brief. Okay, so that is funded by our federal grant funds, which if you're paying attention to the newspaper, federal budget funding is under a lot of pressure right now, and it's hard to continue to get those funds and to continue to have that process go on. And if there's a family that really didn't have follow-up, I would rather the case managers be spending their time making multiple phone calls to that family than spending their time calling a family that's already had follow-up. And that's your federal tax dollars at work. So think about it from that perspective of, do you want your federal tax dollars that are channeled through the CDC and HRSA and to our program to be spent making phone calls to families that already have had follow-up and don't need it? So that's the little bit that you can do by making that follow-up report in a timely way to do your part for the federal budget. Yay. So the next thing that I want to mention too is that if you are using paper forms, if you fax them, that's usually a good way to get them to our office in a quick way and to be sure that they're actually received if you get a fax confirmation. So the next item in this section is identifying that forms are compliant with the JCIH, Joint Committee on Infant Hearing 2007 position statement, and items that we also adopted in our New Jersey regulations. Specifically, those are that if a baby didn't pass an ABR screening in the hospital, we want that follow-up testing to be an ABR. And if the baby only referred 1 year in the hospital, we still want both years to be tested on outpatient rescreening. And you can see we're doing well. I mean, we're 96%. That's really great statewide, but we really do want to see this be 100%. You can see how your facility is doing, and then you can look back at the kids that you've seen, and is that because you're doing OAEs on babies that previously failed ABRs, or is that you're only screening the ear that you think referred in the hospital? And we would like to keep you focused on that. So next is the percent of forms that have a valid pediatrician name in them. Now, on the paper forms, this actually tends to get filled in well and completely. And here's where folks that are using the immunization registry system are sometimes at a disadvantage, because when you start the form in the system, it will actually automatically fill in that physician information field. And sometimes if you look, you'll see a lot of times, especially if the baby's very young, it'll just say EBC and it'll be the county where the baby was born. And that's the default value that's getting filled in the system if the record came from the electronic birth certificate system and no pediatrician has yet claimed that child. Sometimes if you look there, you will find a doctor's name or a practice name. If the child has been to a physician office, has received some shots, some immunizations, and those have been reported via the immunization registry system, then most of the time then that baby is actually linked with a physician office, and this will fill in with good and accurate information for you. But you guys are often seeing babies that are 1 and 2 weeks old and they haven't had an immunization yet, so they haven't had that. We really want you to take the field that if it autofills with a not real person, we want you to go in and update that and give us the real doctor's name, because especially with those babies that are diagnosed with a hearing loss, that have a rescreen refer or transient conductive hearing loss and need to come back for additional testing after their follow-up, we are going to be looking for additional forms from those babies. And if we don't get them, we're going to be turfing those cases to the case managers to reach out to the families and the pediatricians. And, let's say they call the family and the phone's disconnected now. Well, if you've given us a valid pediatrician name here, then we'll reach out to the pediatrician office, and either they might have a good phone number for the family, or at the very least they can flag the chart so that the next time the baby comes in, they can remember to write them a referral for additional audiologic testing. When we have EDC Cumberland, for example, as the pediatrician, we don't know where to go. And we get some information from the hospital at who they think the pediatrician is going to be at the time of discharge, but as I'm sure you guys know, pediatricians often change because they find out they're not in their insurance once the baby gets their insurance card and so forth. So anything that you can do to fill this in would be greatly appreciated. Again, you can see that statewide we're not doing great. We're getting in on less than half of babies. Are we getting a real doc's name there? So we would appreciate your help with that. The next and final section on this summary data statistics report is a count of children that were diagnosed with hearing loss that were born in the time frame of interest and had follow-up in the time frame of interest, and that was reported to us in the EDDI program. This is where I made an exception that I mentioned earlier about out-of-state facilities. And I'll tell you, when I started doing this report, first I just did it with only forms and reports that had come in from in-state audiology facilities. And I was a little concerned because I didn't want you to think that we only had roughly 80 kids a year that are diagnosed with hearing loss, because you see that in, again, the time frame of interest for reports that we had received. By the time the reports were run, we had already identified 80 babies born in that time frame that were diagnosed in New Jersey facilities. And we also had another 18 that were diagnosed in out-of-state facilities. So 18% of the children in this time frame that were diagnosed with hearing loss were in fact diagnosed out of state. So to be sure that you had a real accurate reflection of the incidence of hearing loss in New Jersey in infants, we went ahead and included that. The reason I've excluded out-of-state follow-up from the rest of the report is that our regs really only apply to audiologists practicing in New Jersey. So if there's an audiologist in Delaware or Pennsylvania or New York that sees a baby, sometimes we get reports. We actually, I'm actually going to go ahead and give a shout out to CHOP because they're really good about notifying us of babies that receive follow-up there. But they're not required to submit it. They're not required to meet the 10-day timeline. And in fact, occasionally we'll get babies, I'll hear, oh, well, this baby had some other surgery done at Boston Children's Hospital and had the testing done while there. And we may be able to eventually reach out to the doctor or the hospital or somebody and get a copy of that information and enter it. But so the timeline on that reporting and the documentation may be way off of our 10-day timeline. And so I didn't want that data to skew the numbers when you're comparing yourself to the rest of the state. So that's why we left that out. But this is one of the things I want to mention, that as you look at this and you hear what we've included and what we haven't included, we very, very much would like to get feedback from the audiology community and tell me, like, this is a lousy statistic, doesn't mean anything to me, or this is a really great statistic, or I do want you to include out-of-state babies because I think it's really important. Please feel free. You can chat it now while we're having this and type me a note. You can send us an email afterwards. We do reports as well for the hospitals. And the hospital's quarterly reports are really focused on screening and refer and like any follow-up rate. And the point of these reports was to focus on the diagnostic piece, which is really sort of out of the hospital's control. And those reports have gotten tweaked many, many, many times over the last 11 years that we've been sending them out. So I'm expecting that what you see on this report is not going to be the final end product, but we very much would like it to be some feedback from you guys on what you think would be helpful. So that's the review of that summary statistics page, which was a white sheet of paper that was mailed out to you. And the next report, the other page that was included, was printed on blue paper, and it was titled The Report of Children Needing Additional Audiologic Follow-Up Who Were Last Seen at Your Facility. Now the goal of this is that these are babies who the last thing we got was either a rescreen refer, transient conductive hearing loss, or you said you couldn't get ear-specific data, and we know some additional follow-up needs to happen. We don't require you to send this back to us and tell us what happened to these kids. We have a similar report for our hospital reports. For those of you that are hospital-based audiologists, you're familiar with that. For those of you who are out in the community, you aren't so familiar. But we do want to know specific detail reported back to us. One of the things that we found tricky with the idea of creating this report is we know that there may be babies that maybe you are only able to do rescreening and don't have diagnostic equipment at your audiology facility. Or maybe you can do diagnostic testing, but you can't do sedated testing, and there's a baby that you've seen that really needs to be referred for sedated testing in order for additional diagnostic determination to be made. So we can't totally hold you responsible for the additional follow-up of these babies, and we know that they may have been referred elsewhere. So we're more doing this as an FYI, and really I want to bring you back to the Marcia, Jan, and Cindy cases that Nancy showed you earlier, and that, you know, these are the Jans and the Cindys. These are the babies that have had some additional outpatient testing, and we don't want to see them get lost. We don't want to see them get stuck in a, oh, I'm going to have a rescreen and another rescreen and another rescreen, and we know that these kids need some additional testing, so we want to call them to your attention. And there are three things that you might see. You might see that if you submit us a form with a rescreening refer, and that they're supposed to come back, that's what you'll see on the detail section. And notice that the recommended interval is not noted because on our outpatient screening form section of the form, we don't really have an expected time frame for when they're going to come back. However, on the diagnostic section of our form, we do have this field that asks when additional audiologic evaluation is going to happen. So on this particular form, if you checked off transient conductive hearing loss and that the baby was going to come back in 6 months, you'll see that baby show up on the form saying transient conductive hearing loss, and the follow-up interval is 6 months. So again, you may see babies on this form. You may see babies that were last seen in your office in August, and it's 6-month follow-up. So they're really not due for additional follow-up testing until January. So that's why they're on the report, because they weren't supposed to come back yet. We went ahead and decided to include those babies, all the babies that were sort of still in a pending status, and not to exclude them even if we know that they might still be due in a little while. Again, something to let us know if you find that helpful or if you find that not helpful. And so then also, we have this section on our form that has this sort of other results. Where we just need additional testing. And so how that codes onto the reports is pending your specific information, and again, the time interval. Now notice on this report on the detail, you may also see we've given the pediatrician name. And this is a case where, you know, if you see a name there, that was because there was actually a correct name entered on the form. When it says not provided, that's one of those ones when I talked about we want you to fill in the physician information where it was not valid physician information. And so that will help you see how you can make that item better as well. Now I'm going to turn it over to Nancy for a wrap-up, and then we'll take your questions.
Yeah, I just wanted to, include this slide because really this program has come a long way since it started in 2002, and initially the focus was really very much all about the birthing hospitals, and not just in New Jersey, but throughout the country. The biggest focus now is making sure that those kids that didn't pass get follow-up, and that's just all about our audiology community. So, there's an article that had been written many years ago, 2005, but it holds true today. We can't survive without your help on this, and certainly the kids in our state are not going to be able to be identified without your help as well. So I just wanted to mention that we need you. So thank you. Also, I wanted to take the remaining time, if I could, and ask if you have some questions for us about the audiology facility report, questions in general, and any suggestions that you might have for improvements. Is this a worthwhile endeavor or not? Anything at all that you could contribute, we would appreciate. But feel free to either type them in or be able to just shout them out. And, by raising your hand, Kathy could call on you as well.
And if you muted your line hitting *6, *6, if you hit *6 again, that can unmute your line. And I see a hand up. Let me find it. We have a long list of people here. Here's Pat Connolly.
Hi, Kathy. Can you hear me?
Yep, I can.
Awesome. I have a question about babies born out of state. They follow up in New Jersey, and they live in New Jersey, of course, and the follow-up demonstrates hearing loss. I do appreciate, and I do send the follow-up, a copy of the follow-up report to the state, and for me it's usually New York City, back to the hospital. And these children are going to have all of their early intervention and other hearing services in New Jersey. What is the best way to, how do we need to do newborn hearing in your system, our system?
Sure. We have, over time, developed some really good working relationships with our border states, and it's a little bit different depending on what state, where you guys are physically located and where they're coming from. Okay, so you're closest to New York, and you're getting New York babies. New York previously did not have a centralized data system run by the Department of Health. It was their individual hospitals that were responsible for counting and reporting how many babies were screened and had follow-up and so forth. And so sending the data back to the birth hospital for babies born in New York is very much what they would like, so that they can get their data put together. They are very close to launching like an online statewide data system that's being run by the Department of Health. So once that goes live, they may want data to be reported to the State Department of Health EDDI program. But in the past, that hasn't been true. For Pennsylvania and for Delaware, it is the State Department of Health that track that information. You can send information directly to them. The other thing you can do, you're welcome to put that data in our data system. You're not going to find the baby like in the immunization registry system sometimes if they were born out of state because they didn't have the opportunity to get added via the birth certificate system. But you can add the baby, and you can go ahead and note that the baby was born out of state. You can fill out the form, and then when I communicate regularly with folks in those other states, I'll let them know. You know, if I get a form, say, that says, oh, this baby was born in Delaware and they refer to birth and now they're diagnosed with hearing loss, I will see that when I go to match, and I'll see that they're born in Delaware, and I will notify the Delaware Department of Health EDDI program. Similar for Pennsylvania. It's a little bit, the regs don't really cover it, so you're not required to give us the information on those babies. Obviously, you're required to report the hearing loss, but if it's, say, a pass on a baby that referred out of state, you're not required to give us that information again, but we would appreciate it, and the bordering states would appreciate it.
Okay, thank you.
Other questions? Did we put you all to sleep? Go on. Is there, let's see another hand I'll get to. So one question, let me ask you a question. Is there something, is there something that you would like to see in this report? Is there a number in here that you're like, oh, well, why didn't you tell me, X, Y, Z? And Freddie Jarmel has her hand up. Freddie, can you?
Yeah, can you hear me?
Yep.
Okay, so my question is just the facility report. Did everybody get one? Because I don't remember ever having seen one.
It was sent to the facility, like one per facility, so not every individual at the facility. So sometimes one person may have gotten it. And again, it was only sent if there was one or more child that you saw that was born in that time frame of interest, and had a follow-up report sent to us. So not every facility got it. But you're Montclair State, right?
Yeah.
I think you should have gotten one. I don't have my list of all of the, I have a list of how many kids there were per facility, and I have you on it. So I think you should have gotten one, and I'll have to follow up with you to see, to verify that it was mailed and whose attention it went to.
Okay, great.
Okay.
Thank you.
we have a chatted-in question, which is, do you ever break the report up by each audiologist at the facility? Or is it always just including all of the audiologist stats together? Well, so do we ever? Well, this is our first time of doing this report, so we haven't ever, but we could consider it. My gut response to that is that most facilities had just a handful of babies that were seen in the time frame of interest that met this. In fact, I looked at this morning, so I have the list of how many and counted up. I have 21 facilities in New Jersey that saw over 20 babies during the course of the entire year. The rest of the facilities, there's a lot of facilities that got reports for 5 and 4 and 3 and 2 babies. So to break it up by person, you know, when the numbers get that small, is going to be harder. It's certainly something that if there's interest in that, we can work with you. We can work with an individual facility and try and run the report for each of the audiologists to see how that can help you improve your practice. Other questions?
This is Nancy again, and I just wanted to mention when Freddie asked the question about reports, you know, make sure that you know that the reports that we're talking about are the newborn hearing follow-up reports and not the state birth defects registry, you know, with the form that you fill out for children that you've got confirmation of permanent hearing loss in one or both ears that is filled out for children from birth through 21 years of age, because I know we've gotten some of them from you for sure. So these are just going to be the newborn follow-up reports for the birth to 3 kids.
And so let me remind you that you can always think about, hopefully you've got Nancy's email when you got invited to join this. Maybe have mine as well. You can also reach us at our EDDI program email, which is EDDI, E-H-D-I, at doh.state.nj.us. If you have things that you think of later. One of the things that I'd be interested in hearing back is, like, how often would you like to get this report? Again, it's the first time we ran it for babies born from July to June to pick a year time period to have enough numbers for most facilities to get a report. The hospital reports we send out quarterly, but again, I think for most audiology facilities, they might only see 1 baby a quarter. They might see less than 1 baby a quarter. And so if I ran this, in 3 months from now, it wouldn't look any different. But any thoughts that you have on how often you'd like to see this data would be helpful to let us know what you think. Also, how you might make use of this. We'd love to hear it. If you're using this to say, hey, maybe we need to slot more hours, more open appointments. Maybe we need to hire another audiologist, and this is giving me the ammunition to do that. We'd really love to hear back from you and hear how we can work with you. Because again, remember, our goal really is you guys are doing the work, and our goal is to support you in any way that we can to meet. We know you want to meet those goals as well. We know you want babies to get diagnosed early so they can get in early intervention services early. So, anything that we can do, any way we can use the data to help you, we're happy to do so.
And this is Nancy again. I definitely wanted to emphasize we know that this is a lot of work for everybody. I mean, you're seeing the kids and you're doing the testing and you're writing the reports and you're doing a million things every day. I know that very well. And anything that we can do to make this process easier or more reasonable, we're definitely open for suggestions. Also, I just wanted to mention for anybody who's on the line today that's interested in getting a continuing education credit for your New Jersey audiology license, I'll be sending out a webinar evaluation form later today. And if you could get that back to me either via fax or email, by Monday of next week, then within the coming 2 weeks you'll receive a certificate of attendance that you want to hang on to for dear life, because that'll be the only record that you attended, and you can use that toward your New Jersey audiology license if you need that for this biennial period.
And the other thing I'd like to encourage you guys to do is let us know if there are other topics that you are interested in hearing presented in this webinar format. If this worked out well for you and you've got some ideas about what you would like to hear, we'd be happy to schedule other topics for you.
Are there any other questions for Kathy or I? Well, I don't think so, but I very much appreciate you all joining us today. I can safely speak for Kathy, Marcia, Jan, and Cindy, and myself that we want you to have a very safe commute home today in the snow, and happy holidays, and please don't be a stranger, and keep us in the loop and call us anytime. And thank you so very much. Oh, look at the artwork happening there. So thanks again, everyone, and thank you, Kathy, for your presentation, and be on the lookout for your evaluation forms. Thank you.